So our 9 health expert, Dr. Pao Coley, is back with us. We talk about how frustrating this is for many people, including Governor Polis, because we're talking about Colorado having many people vaccinated, and yet still we are seeing a surge.
It's ridiculous. And I know I like to be a glass half full person most of the times, but in this case, the glass is 20% empty. 1 out of 5 Coloradans is not vaccinated, and that is ridiculous, and that is why we're seeing this kind of surge. Now, there are a couple of other reasons as well. Our behavior has changed. We're back in schools, we're back to gatherings, very different from what we were doing at this time last year. And I do think there's some component of waning immunity, which is also kicking in, because many of us got our shots more than 6 months ago, so we need to start getting those boosters. But I think the most important thing that's going to help our fight is getting that 20% vaccinated.
And when you talk a little bit about that 20%, so many of us thought, I mean, to be fair, a year ago, we were like 80%, well, then certainly we'll have some herd immunity at that point. We should be okay. But you mentioned kids. I mean, there are kids that weren't able to. What's going wrong here, though, in Colorado, for us to be having this spread and the numbers so high?
Well, the first thing is we need to move away from herd immunity, because herd immunity, number one, assumes that as soon as you get immunized, you can no longer spread the infection. And with Delta, we know that even fully vaccinated people can still continue to spread the infection. The second piece of this is that because the virus is so contagious, that herd immunity threshold, which was 75 to 80 for the original Wuhan variant, is now substantially higher. So we really cannot count on herd immunity in order to stop the spread of the infection. We have to change our behavior. And the problem is the virus moves, we move. But in the last several months, the virus has been moving, and we haven't been moving in return. We haven't been changing our behavior to mitigate.
Yeah.
I don't ask you this very often, but I want to talk about the emotion of doing what you do for a living and seeing it fail, because I see your frustration at times, but also the fact that you have to treat people who are sick, and you have to work with many people who have to deal with patients now who are far sicker than they ever should have to be. The going forward part in the healthcare community seems to be like patience is gone.
I think compassion fatigue is an understatement at this point for what we're feeling. You know, it's frustration, it's anger, it's resentment, because science has come so far, and we need people to come the rest of the way. And the problem is, again, as the governor pointed out, you're not just hurting yourself, you're hurting everybody else in the community. And our goal as physicians has always been to protect, and when you're not able to do that because people won't cooperate, it's incredibly, you know, it makes you feel completely out of control.
Yeah, I think you hit on a thing that many of us feel, but your job is the ones to care for these people. I mean, you're beating your head against a wall talking about this, but you're really mentioning the booster now, because now it's like next level. We all have to take responsibility for other things.
That's right, Kim, but I have to remind everybody that boosting is not going to get us out of this pandemic.
Nope.
Vaccination is. You know, so we can do our part in boost, but it's still going to be the same game of wearing those masks, staying away from each other, because it's just a matter of time. With the amount of infection we have here in Colorado, before that next variant emerges that's resistant.
Plus winter.
Well, hopefully we get that counter surge with the increased vaccinations now going to younger and younger members of our communities.
I am so excited about this, because I do think that is going to be a big piece of that pie. That is going to help to mitigate that exponential spread, because what we saw in the last 2 weeks is the cases are climbing like this.
Yeah.
And we know that infection begets infection because exponential spread occurs. But we start to get those kids, hopefully as early as tomorrow, that's really going to blunt that.
Well,
Okay.
thanks as always. We love to catch up with you and get the latest and understand where things stand. So we'll keep bringing you back.
Yep. And this is a perfect segue, because tomorrow we are hosting a town hall of Colorado health leaders to get your questions answered when it comes to kids and vaccines. Again, you could have your child fully vaccinated by Christmas if everything goes as planned. Text your questions to 303-871-1491. We'd like to have you include your name and where you're from. That way it kind of personalizes a little bit. And then tune into our town hall tomorrow at 4:30.